The last question. I read recently that when people experience emotions, they feel physical sensations in their body. Specific emotions cause a specific set of sensory feelings, and this is how people identify which emotion they're feeling. I can describe in theory the physical sensations that represent an emotional state, but I cannot identify these sensations in myself. Therefore, I cannot identify my emotional state. My questions are, how do I identify which of my physical feelings are emotional feelings and which are just sensory feelings? And how can I differentiate these sensations? This is from
Okay, very important question. When I talk to adults with Asperger's, they often describe a mind-body distinction. And their mind, their intellect, their thought seems to be detached from their body. This is a psychological component, but also, we think, a neurological one. There's a part of the brain called the amygdala, deep within the brain, which is responsible for scanning the sensory system for danger or threat and alerting the body for fight, flight. But it also alerts the body, the frontal lobe, the thinking part of the brain, of internal sensations from when you need to go to the toilet, hence toileting accidents for some of these kids when they're young, to the ability to identify when you're becoming increasingly agitated or about to have a meltdown and explode. They're often the last to know until the explosion is so great, because there's less white matter, that is neural connections between the amygdala and frontal lobe, as a warning system. So the frontal lobe, the thinking part of the brain, is often not connected to or communicating with the internal parts of the body. So when you ask someone with Asperger's, how are you feeling now? They'll often say, I don't know. And they're not being obtuse. That insight, it's not only theory of mind, the ability to work out what others are thinking and feeling, it's what you're thinking and feeling yourself. It's thinking about thoughts and emotions in individuals and self. What we try and do is cue the person into some of the bodily sensations. For example, when you get agitated, anxious or angry, your heart rate increases. So we'll use the sports devices that do heart rate, so that maybe a ring or a watch that gives you your heart rate, monitor that through the day or in particular situations, and then see that your heart rate's reached 105. Okay, close my eyes. How's my body feeling now? Perspiration. I can hear my heart. All these sorts of things going. That means I'm stressed out or anxious. It may be that they need someone to work through how to identify the internal signals cognitively, because that acts as a warning system in various ways, but also to allow yourself to be in touch with the feelings can help you in many, many ways. But it's a very important question. Mm-hmm. We haven't got a simple answer to it, but in due course I think we will.
Dr. Tony, I want to thank you again for taking time out of your busy day to come in and answer questions from folks here at Autism Hangout. I thought this roster of questions was just amazing.
I'd like to thank the people who ask these questions because they're so important.